we're getting a little bit of breathing room right now because it's not so windy. The red flag warning is gone away, but it's still warm. It's still dry, and there might be winds next week. So we're not going to let our guard down. We're still out there mopping up, trying to put this fire to bed before any more red flags are predicted.
Thousands of people across the Los Angeles area have left behind homes and businesses as deadly wildfires spread across Southern California. And this area has a history of wildfires, but as we've heard from officials, this is an extreme case, with so many saying they have never seen conditions like they're seeing today. Earlier, I spoke with the general manager of a local restaurant chain about his experience and just the fierce timeline with these devastating flames.
I think the main difference this time is that it's just the winds are so incredibly strong, and there seemed like there's nothing that the brave firefighters can do because it's just so big, so fast. Yesterday morning, I got to work about 9:30, and everything was fine. But by 10:30, we could see smoke. By 11:30, it was increasingly obvious that there was a big problem. And by 1 o'clock, we left the area, and just watching the acreage burning from 700 acres to now 1,000 acres to 5,000 acres. And unfortunately, the winds are still strong, and I don't know what you can do to prepare for something like this, unfortunately.
As of Wednesday evening, the fires in Los Angeles County remain at 0% containment. Some flights scheduled to land at Hollywood Burbank Airport Wednesday were diverted due to the fires. Passengers say they were instead sent to nearby Los Angeles International Airport, which has been largely unaffected by the situation. According to Flight Tracker, FlightAware, at least 18% of trips out of Burbank were canceled on Wednesday. Officials at Burbank say people should continue checking with airlines on the status of their flights. Millions of Los Angeles residents are facing extremely hazardous air quality as wildfires continue to burn around the city. On Wednesday, the air quality index in LA was 178. That's considered unhealthy for anyone who is active outdoors. Air Now, which monitors U.S. air quality for the Environmental Protection Agency, warns those who are at high risk for respiratory issues should take extra precautions. For more, I want to bring in Dr. Irina Draluk. She is a pediatric pulmonologist at Cedars-Sinai Medical Center in Los Angeles. Doctor, thank you for taking some time to speak with us today. How bad is it in your area? What are people's symptoms right now?
Hi, thank you for having me. So things are fairly bad right now, but I think it's probably going to get worse as we have more exposure to the smoke in the air. So a lot of our patients, respiratory patients who have pre-existing asthma or other respiratory conditions, are starting to show early symptoms of exacerbation and toxicity to the smoke. So things like cough, wheezing, increased difficulty breathing are starting to occur in a lot of our patients.
What health risks can erupt from the smoke and the poor air quality?
So the exposure to this type of fire and the smoke that people are inhaling, unfortunately, is very dangerous because the small particle size can get to the distal or the small airway and cause a lot of inflammation. So this can cause both acute or basically symptoms right now, but also a lot of lingering, prolonged issues that could take months to resolve. It can lead to acute respiratory distress in patients who both have pre-existing respiratory conditions, but also patients who haven't previously struggled from breathing problems.
And what can people do to protect themselves? I mean, obviously, we know stay inside if you can. Not everybody can. But what should people do both inside and outside?
Sure, that's a very good question. So a number of things. If somebody has air purifiers in the home, I would certainly run them around the clock if you have power. Or run it off a generator if that's an option. We do have a lot of power outages right now. If somebody is able to get more air purifiers for their home, that's another thing to add in. Making sure that windows and doors are closed. So those things are, kind of common sense. But also when we go outside, to make sure to protect our face, our nose, and our mouth should be covered. At the very least with something like a bandana or a basic mask, but ideally with something that's designed and geared towards protecting us from inhalation of small particle size. So either a K95 or something of that nature. I actually literally just ordered a stash for myself and my family and friends and everybody. Going outside right now, you can really tell, as soon as we go outside, we start coughing. You could feel it in your throat. So just having protection on one's face when we're outdoors is a big help. For anyone who has a pre-existing respiratory condition, something else that should be done and can be done is making sure to have all of your medications stocked, be taking the medications that are prescribed, and then also be taking extra medications if necessary and having symptoms early on.
All right, smart advice, Dr. Irina Draluk. Thank you so much. We're thinking about your community.
That was the Los Angeles fire outbreak, the devastation, and how to protect your health. Let me start with a question. Have you ever stopped to think about how fragile our safety is when nature decides to remind us of its power? Today, we are talking about something truly heartbreaking: the devastating fire outbreak in Los Angeles, in the United States of America. These fires have left scars on the land, displaced thousands of families, and polluted the air we breathe. It's a reminder of how unpredictable life can be and how quickly things can change. My heart goes out completely to everyone affected, those who've lost their homes, their livelihoods, and most tragically, their loved ones. I am so sorry. May God comfort you. These fires don't just destroy buildings, forests, they change lives forever. Families are now faced with rebuilding from scratch. Wildlife habitats are wiped out completely. And then there's the smoke, a silent, invisible threat that doesn't just stay near the fire. It spreads across cities, impacting everyone in its path. Let's talk about the health risks associated with smoke polluted air. Did you know that wildfire smoke contains fine particles known as PM2.5, which can penetrate deep into your lungs and even enter our bloodstream? Breathing in this polluted air can cause serious health issues, especially for those with pre existing conditions like asthma, heart disease, or chronic respiratory problems. Just like the doctor said, even healthy people can experience irritation in their eyes, their throat, and their lungs. And long term exposure, that's a whole other level of danger. But you are not powerless. There are steps you and I can take to protect ourselves and our families during this crisis or kind of crisis. First and foremost, if you're in an area under evacuation orders, please leave. No possessions are worth risking your life for. For those living in areas affected by smoke, but not directly threatened by the raging fires. One, stay indoors as much as possible, especially during times when air quality is at its worst. Two, use air purifiers with HEPA filters to clean the air in your home. If you don't have one, even a damp towel over your nose and mouth can help filter out large particles. Three, avoid outdoor activities, particularly exercising, as heavy breathing exercises increases your exposure to pollutants. Four, seal your windows and doors to keep the smoke outside. And if you have air conditioning, switch it to recirculation mode. For those who have to go outside, wear a proper fitted N95 mask. Regular cloth masks won't protect you from the fine particles from the smoke. So it's crucial to have the right gear. And let's not forget the emotional damage, the toll. Watching your community burn, worrying about loved ones, and feeling like you're powerless to help. It is overwhelming. Please don't hesitate to reach out for support. Reach out to the necessary authorities, talk to someone you trust, seek professional counseling if needed, or even join online support groups that have been created. Let me ask you, how prepared are you for emergencies like this? I am not. Have you thought about creating an evacuation plan, stocking up on essentials, or staying informed about fire safety? Share your thoughts in the comments. I would love to hear how you are taking steps to stay safe and support others around you and others in your community. To everyone affected, please know that you are not alone. Communities across the world are sending their love, their prayers, and resources over to you. And to those watching from afar, if you can help, whether it's donating relief efforts or spreading awareness, please do something. Let's stand together in these difficult times, support each other, and remember that even in the face of devastation, resilience is our greatest strength. If you found this video useful, helpful, please like, share, and subscribe for more health focused content. Stay safe, take care of each other, and protect your health during this challenging time. Thank you so much for watching. My name is Ingo, and I am passionate about helping you look your very best, no matter your age. See you in the next video. All the best.